Good afternoon all. Today our topic is the uterine displacement. What is the uterine displacement? Uterine means uterus, displacement means the changing the normal position. The uterus normal position is the anteverted position of the uterus. Means displacement means changing of the backward or frontward or anterior or posterior. So the changing of the position of the uterus is called as a displacement, uterine displacement. Coming to definition, the uterus when displaced backward in term as a retroverted uterus. The uterus has to be displaced as to the backward, bending of the backward is called as a retroverted uterus. And when it is displaced downward, the uterus has to be displaced into the downward is known as a uterine prolapse. Okay, so once again has to be definition. The uterus when displaced backward in term as a retroverted uterus, and when it is displaced downward is known as a uterine prolapse. So how many displacements are there? Okay, what are the abnormal position of the uterus? You can see. Okay, here we are during the direction of the displacements. So normal position of the uterus is here we are seeing to the white color, that is a normal position. That position we have to call as a anteverted uterus. So here we are seeing the three positions of the abnormal displacements. One is a retroversion, and second is a retroflexion, and third one is a anterior flexion. So retroversion means the uterine can be backward in the mouth. What is the where is the this has to be totally the uterus retroversion first figure. The uterus has to be going to the backwards, the bending of the backward. Because of that, pressure has to be in the rectum and the spine also. Due to the mother has to be suffered for the constipation and back pain also in this type of retroversion uterus. And this is a very difficult to occur as a pregnancy. If you are occurring also, that abortion also will be occur into the retroversion uterus. And coming to retroflexion. Retroflexion means here the body of the uterus has to be bending to the backward. That is the retroflexion. Okay, and coming to the anterior flexion. Anterior flexion means the uterus will be bending of the front. The uterus has to be bending to the front. Because of downward, that is a bladder. Wherever your red color, this is heading to the downward, no, that is a bladder. So what will happen when it is the anterior flexion? The mother has to be in the urine incontinency. So the mother has to be the continuation urination. He cannot stop for the urination. So urine frequency has will be more at the this type of position of the uterus of the mother. So what is the etiology? What is the causes of the displacement of the uterus? They have the some causes are there. They have the repeat pregnancy at the closer intervals. They have the actually we has to take the mother has to take child to child 2 years period, but in the repeatedly continually in the continued pregnancy, this displacement will be chance to occur of the uterus. And next lifting of the heavy object in the during the postnatal period, because of in the period the uterus has to be take for the pre-pregnancy stage. So in that, if she has to be weight and the weight the heavy whenever the heavy object has to lifting, the pressure has to be in the lower muscles. So what will happen? So some displacements or some protrusion also will be occur into the in the pelvic organs. Okay, in the postnatal period. So the doctor will be advised when the postnatal period has to be don't carry up the heavy object and traveling has to be avoided, we will say, because of the displacement of the uterus and prolapse also uterus also will be occur. Next, some pursuing career, women pursuing career in the sports, women and dancers, and to heavy exercises. So these type of mother also will be chances to the displacement of the uterus. And during childbirth, when the mother has to be in the lacerations. So if the proper time when the during the labor, during the whenever the baby has to be born in the second stage of labor, if you proper time, if you're not doing for the episiotomy, the irregular laceration will be occur into the cervix and the vagina and the perineum. So in this laceration, so protrusion also will, displacement of the uterus also one of the chance to occur. And habitual constipation, hard stool, this also will be one reason, and constant of a habitual distension of the bladder. So we are seeing further anti-flexion of the uterus low. The uterus has to be, the weight has to be into the pressing onto the bladder. So in this distension of the bladder also will be occur. Next, any tumor in the pelvic or abdomen, and injury of the sacrum, any trauma, accident or injury of the sacrum. And next, after difficulty labor, so the long period of the labor pains also will be, this is the displacement of the uterus will be occurred. So what are the signs and symptoms of the retroversion? So the feeling has to be, mother has to be feeling have the tightness, backache, because of the uterus has to be backward, they has to press into the rectum and spine. So backache will be continuously and painfully menstruations. So because of the mouth of the uterus has to be coming to the not to the cervix, they has to go to the displacement of the mouth of the uterus. So in the narrowing of the vaginal place, so painful menstruation will be occur. Next, constipation. So hard stool and frequency of the micturition, abortion or miscarriage will be occur. So what are the signs? Cervix is displaced, fundus in Douglas pouch, absent of the uterus interior. These are the signs of the displacement of the uterus. And one more that also will be rectocele. In this they have some protrusion swelling also will be occur in the related pelvic organs, means bladder, rectum, okay, and small bowel, small intestine and urethra. This protrusion and the swelling also will be occur. Mm. Okay.